past year or so, I have been working as a homelessness inclusion team specialist nurse.
Hey, welcome to my channel, Being a Carer with me, Kes. My name is Kesienaakwaraatie, a health and social care trainer. A gazillion merci beaucoup to all of you, my returning subscribers and my mentees, and of course, those of you who are on my membership platform. Thank you for your support. It means a lot, honestly and truly, believe it. Okay, and hey, if you're just watching this channel for the first time or you came upon it perchance, hi there, welcome. On this channel, I talk about everything care, how you can excel as a carer, a support worker, a healthcare assistant, and how also you can aspire to other things, because care isn't all of it. Okay, and how can you be a part of us? You smash the subscribe button, you give me a thumbs up by liking the video, and don't forget to click on that all important notification bell, so whenever I upload a new video, you'll be among the very first to know. Freely connect with me on Instagram, TikTok, Twitter, Care by Kes, and as always, I'll see you there. Now today I have this wonderful lady, wonderful sister with me, and we did a video, we talked about the over 30 different types of nursing paths you could pursue in the UK. So I have this lady in person, flesh and blood, to talk to us about these paths, because she's also in one as well as we'll speak. Now I'm not going to do all the talking, I'm going to hand it over to her. Okay, and so lady,
Yes.
fair lady, you see, can you introduce yourself to us, please?
Thank you, Kes. Hello, good people. My name is Gugu. I am a nurse and I've been nursing for over 14 years now. I worked first as a nurse in an intensive care unit, the general intensive care, not specialist one, where we have a neuro or cardiac patients only. But this one was for everything else besides any specialisms. This was a challenging area to work in because people here will be critical, as you would know, and quite a high death rate too.
Wow.
So different skills needed for that area, a lot of empathy, a lot of understanding, counseling type skills, reassuring, and patients do get very confused when they come out of induced coma sometimes, because they may have been experiencing dream-like situations while they're in these comas. And when they come out, they tell us all sorts of stories sometimes about what they have been going through.
Wow.
So a very interesting area to work in. After a few years, I moved on from the intensive care nurse and worked as a discharge coordinator.
Okay.
Another exciting job as well. I did this job as a band 6, just a senior nurse.
Okay.
In this area, I worked mostly with complex discharges. When we talk of complex discharges, we mean people who may not be able to go home without any help. So they need some help. It may be that they just need a carer at home. So I have to contact the social services, send a request for care, explain what the care needs are. For me to explain this fully, I would need help from the occupational therapist and a physiotherapist, because they know what exactly the patient needs. They may need new equipment at home. They may need rails to be fitted around the toilet and the bathroom because they need help to stand up. And they may need once a day package of care, twice a day package of care, 3 times, 4 times. In some cases, they need 24-hour care. In these situations, the majority of people will need to go to a care home. So we make those referrals. We talk to different nursing homes. They come and assess the patient, and they accept the patient depending on their capacity and the costs involved. Some patients have to pay for the care home, others can be paid for by the state. So it's quite an involving job, but very exciting.
Beautiful. How long did you do this for?
I did this for about 6 years, discharge coordinator job.
Okay, and so the other one was for 8 years? No, you said you've been in nurse for about over 14 years.
Yes. So more than 6 years I was in intensive care.
Okay.
Yes. So in the past year or so, I have been working as a homelessness inclusion team specialist nurse.
Wow.
So this is a fairly new role as well. It's
Okay.
coming up in most hospitals,
Okay.
but some hospitals don't have this department.
Okay.
This department is for helping homeless patients who present to hospital. we try very much not to discharge patients back to the street,
Okay.
because it's obviously not the right place to be, particularly if you are poorly. However, we don't always have the housing for these patients.
Okay.
We refer them to the council, and we write supporting letters to advise the council that for reasons A, B, C, this particular person cannot live in the street. The council will usually argue that they do not have housing available, and they will only help people if they have got what they call a priority need.
And what is the priority need?
A priority need is a situation where the patient is more vulnerable in the street than an average person. For example, if you need insulin injections because you are diabetic, insulin injections have to be kept in the fridge for them to be safe and usable. In the street, you cannot put your insulin in the fridge. So this presents as a priority need.
Okay.
If you need care because you have got care needs, you need help to wash and dress, nobody can come and wash and dress you in the street.
Not an
So
address.
that is a priority need.
Okay.
So, and there are many other needs. If you have a wound that is infected very badly and you need a nurse to help you to dress the wound, a nurse cannot look for you in the street to do this. So that is a priority need.
Okay.
So
Based on the priorities, you now give them homes to
Yes.
live, shelters.
So
to
the
live in.
council has an obligation to help
okay.
under the law. However, there are people who will not have recourse to public funds. So this is another area.
Oh my God.
These people may be asylum seekers who have failed to get asylum. They have been rejected and they have exhausted all the appeal processes.
Oh dear.
So these people, then the council has no obligation to give
help
them a
them.
house, even if they have a priority
They
need.
need. Oh wow.
So in these cases, we approach charity organizations,
Okay.
crisis, shelter, missionary help, hospital type places.
Yeah.
There are quite a lot of them. However, it's very common that they are full.
Oh
They do
dear.
not have capacity.
Oh dear.
Because there is a lot of people who actually do not have recourse to public funds.
Really?
Yes, there is quite a lot of people, unfortunately.
Wow.
Some of them it's because of situations around substance abuse, including
Oh good.
alcohol abuse and maybe drug abuse, illicit drugs, where they did not regularize their status when they had a chance to do so. These are usually people from Europe, from maybe Poland or places where
Okay.
they can regularize their status, but maybe they may not have done this because they have other problems.
Oh dear.
But this is not everybody. There are many different reasons why people may not have regularize their status in time.
Wow.
So yes, so I'm working now to help homeless people to be discharged to some safe place.
Beautiful. So you're working as a band what now?
I'm still a band 6 only because I did not take the time to do a management course. Naughty. I am a mother, so you do get distracted,
Yeah.
busy with other things.
Other things.
It is very important to do courses as you go because it helps you to show the evidence that you can work as a senior person and as a manager. So I am a senior nurse, but I'm not a manager as such.
Okay.
However, I am fairly content at this moment because I have so many other responsibilities that are taking me away. However, it's not good enough.
So what is that management course you ought to have taken or you ought to have been working at for you to qualify as a manager?
There are so many varieties.
Okay.
And sometimes it is just a matter of being brave enough to offer the manager where you work to shadow them,
Okay.
or to offer to help with certain roles. And
Okay.
they can train you as well
Okay.
in the board.
Okay.
However, there are a lot of NVQ higher level courses, level 5 courses that can be done. And because I have not yet taken the time to do this, I may not be the best person to actually at this stage direct and advise. if I am honest.
But at least she's told you that for a managerial role, because I know that for a managerial role, you must have NVQ 5. Even if you don't have your own business, you must have NVQ level 5. It shows you that you're able to manage people. You can advance as much as 6 and 7 if you wanted to. Okay, so there's one question. Let me ask this question before I go to the next. Do you enjoy this your new role?
Absolutely, 100%. This new role gives me an opportunity to help people who are not your typical person to help. As a nurse, you may not think that my job is to help a homeless person. So it's been an exciting and a very insightful and humbling role.
Wow.
And quite eye-opening. You will find that, however, there are some people who may be homeless, but they may still be quite choosy with
Are you kidding?
It does exist, I'm afraid. They may refuse certain offers of housing.
What?
And, yeah, indeed, and they actually opt to be in the street. And
Oh my.
And because sometimes as human beings we will have different illnesses, and mental illness is not exempt from us as human beings.
No.
So sometimes there are some mental health issues that may impact people's decision making.
Yeah.
And they may say, I don't want to live outside London, for example. So if you give me a house in Manchester, I'm not going. I'd rather live in the streets of London than in a house in Manchester, because I like to be in London. So those choices may not sound wise to me and you, but everybody is entitled to their choice.
I mean, you watch the TV where they are relocating families. Everybody's like, no, we don't want to leave London, we want to be in London. But the truth is that London is very diversified. You know, it's a cosmopolitan, or let's say city.
Yes,
indeed. You know, it's very diverse. So you must at some point see somebody from your own neck of the woods in the world, wherever you're from in the world. You must see somebody from there. So on a last note, because I know my people don't like long videos.
Yes.
I have a lot of nurses who come to me and ask questions and all of that. And I did a video recently of the over 30, different nursing paths we have in the UK to pursue. So I want you to, I want to know, before I get to that point first, these roles, do they have sponsorship? These other roles, do they have sponsorship?
Yes, I would not see any reason why they would not. There are roles that are being promoted and advertised and encouraged very much amongst nurses.
Okay.
So they should be treated, and they will be treated just as any other nursing role.
Okay.
Because you do need a nursing degree to do this job. One of my roles is to write supporting letters based on the medical conditions of the person.
Okay.
So I have to look carefully into their conditions. There's a lot of people with seizures, and unfortunately most of them are alcohol-induced seizures.
Okay.
Because there are quite a lot of people who are alcohol dependent within the homeless community. So I have to write a letter and explain why seizures are a priority need, why they can present that. So I have to explain what are the consequences, what sort of medication do you need, what sort of support do you need if you have that condition. So I need my nursing cap on and to understand this. So
yeah, beautiful. So you've heard Google. There are some of these nursing roles have sponsorship. So go and do your research and find out what those roles are. So what would be your advice to those who are aspiring to be nurses, who are presently carers but they want to get into nursing, or those who are in nursing and they want to advance their careers, they want to go further? What would be your advice?
My advice would be use Google. It's not the
Google like your name.
Well, my name is Gugu. Yes. Google things, nursing jobs, and then you will just expose yourself to different types of nursing jobs that are in existence out there, because there are a lot of varieties. And visit university websites and see what do they have to offer. There is a lot one can do, but it starts with just talking to our fellow nurses, ask different nurses what they do and what they aspire to do.
Okay. So you encourage them to just break boundaries, let nothing hold them down, but they to move on.
Absolutely, 100%.
Beautiful. I mean, I'm not a nurse. You've heard the nurse. But let me ask you one question. I know they will have this thing going on with carers and nurses. Why do we fight? Why do you guys look down on us? Yes, it's not personal. We'll come to you to take personal. Why do you guys treat us the way you do?
The nurses and the carers.
Yes.
In my experience, there is not too much fighting, except that sometimes the workload is quite high and the expectations from either side sometimes are different. The carers sometimes in a ward setting may feel that maybe the nurse should do a bit more on their side, but the nurse may feel that only because the workload can be quite high. Yes.
So the workload is the paperwork or what?
Both.
Okay.
The nurse may feel that I have a lot of paperwork to do. I have given this injection and I need to explain a few more things about it. I can't just walk away. I need to sign this and that paperwork. And the carer may feel that I have already given a commode to patient A, and you want me now to take the urine bottle to patient B, and at that same time you still want me to make sure that patient C has got their dinner served. So
So you have to divide yourself into 3 people.
But it's all communication.
Exactly. I mean, the key in healthcare is communication, effective communication. It should be clear, concise, and precise. So the person who is being told what to do knows exactly what is expected of them. So we've taken a lot of Gugu's time. Okay, so we're going to let her go. But before we do that, I would like her to say what we normally say, and that is my goodbye song, that no matter what the matter is, you matter so much more. Over. That's my signature off.
Okay. Thank you.
So it would be nice if we said it together. Okay?
All right.
Okay, do it again. Right? I tell you what it is again.
Yeah, tell me what it is again.
So no matter what the matter is, you matter so much more. Over.
Okay.
Ready?
Yes.
All right. Let's go. No matter what the matter is, you matter so much more.
So much more.
Over.